You have helped us with the HIV program. We're almost halfway, and we will take it up from here.
I know you're embarking on strategies. I mean, you have this one, the Travelers Outreach Program, Strategic Travelers Outreach Program, and so many others I want to assume is towards attaining the 2030 goal. What exactly is that particular program and how much success?
So this is linked. This is linked to the issue of transportation. As you're probably aware, a lot of times HIV tends to follow major routes, partly because of truck drivers and particular areas where they tend to park in order to spend the night. And in these areas, you tend to have a lot more issues with female sex workers and their ability to have relationships, etc. So what we've been doing is working with the transportation sector, particularly the Federal Ministry of Transport, and also with an organization called ALCO, which is the Abidjan Lagos Corridor Organization. It's an affiliate of ECOWAS, and it deals with transportation issues across the highway that goes from Abidjan to Lagos. It's quite a major highway, and we've done a lot of work there in terms of advocacy. We even have facilities that are across the borders that provide HIV testing. And over the years, in the last between 2010 to 2015, for instance, we've seen a significant reduction in the number of truck drivers having HIV by 60%. And among female sex workers along those routes by about 30–40%. And as you know, with HIV, prevention, as with anything else, prevention is better than cure. It's much cheaper. It's much cheaper to prevent a single case of HIV than to try and put somebody on treatment for life. So what we're doing is really a multi-pronged approach. We're saying, yes, treatment is really important. We need to identify those who need to be on treatment, put them on treatment, and keep them on treatment. But we also need to identify those that are most at risk.
So you pride yourself on a successful outreach program or strategic program, as it were. What really are the hidden challenges in this?
So as with everything else, there are challenges. The biggest challenge we have is funding. Because most of the funding for the HIV program comes from external donors. 1 million plus Nigerians on treatment, 95% of them are being paid for by external donors. The federal government is responsible for about 60,000. That's about 5%. But I can tell you there's no state government that currently has a HIV treatment program. None. None. HIV is not a tertiary healthcare problem. It doesn't really sit within the federal government. We, as part of federal government, we are doing what we can to help the states.
So why do you think this killer virus has taken backstage in states?
Well, a lot of issues. Historically, in the past, if you may recall, Nigeria was one of the first countries to start putting people on treatment. And then we have external donors coming in, and people took a step back, especially the state governments, because we know that there are challenges in terms of funding. We know that there are other priorities that they have to fund. So, of course, if somebody is willing to look after your own, it's very unlikely that you'll put money there. But the fact is, these programs will come to an end sooner or later, and state governments need to start putting resources into HIV. I've had discussions with them. Myself and the Honorable Minister of Health have presented on 2 occasions to the National Economic Council. They've agreed to put 1%, a miserable 1% of their monthly federal allocation towards HIV. And if every state was to do that, we'll be able to put another 500,000 Nigerians on treatment.
And you think that is a miserable 1%?
Well, I can tell you that is HIV important enough to take 1% of your budget? And I will argue that it is. HIV is one of the diseases that has the highest impact in terms of detrimental decrease in GDP. People living with HIV are the productive part of society. They are the young, the youths, etc. They are the people who go out and seek bread for their families, etc. If you look at some of the sub-Saharan countries, including Nigeria, the biggest drop in life expectancy was because of the HIV epidemic. And the current reversal of life expectancy is not because of anything, but because HIV programs have been so successful in parts of sub-Saharan Africa. And
well,
that's why.
We certainly could go on, but most definitely would have to take this a notch higher in another edition. Thank you very much, Dr. Sani Aliyu, for coming on Dateline.
It's a pleasure.
Thank you.
Thank you.
Well, thank you very much for your mails and tweets, as always. Keep sending in your views and comments using the email address and Twitter handle on your screen. Also, be sure to share anything happening within your locality. And don't you forget, you can view the program on youtube.com/channelsweb/videos. Thank you for watching this week. I'm Gloria Umezu.